Everyone, welcome to our December Borough Board. It seems like it was less than 2 weeks ago we had our November Borough Board, and that's correct because we had a special Borough Board convened toward the end of November to discuss MIH and ZQA zoning, which was a lot of fun, right?
Right. A lot of fun.
Just want to announce that, per usual, this is live streaming on our website, so these proceedings are being live streamed, and then there'll be archived recording on the Borough President's website, www.manhattanbp.nyc.gov. To my left, we have Matthew Washington, the Deputy Borough President. So we'll begin today's proceedings with the adoption of the December 17th, 2015 Borough Board Agenda, which you all have before you. Do we have a motion to adopt?
Yes, motion.
We have a motion, so moved. Second?
Second.
We have a second. All in favor?
Aye.
Opposed? Abstentions? We're hearing none. Motion passes. Next, we have an adoption of the November 19th, which was the regular 2015 Borough Board meeting, as well as the November 30th, the special Borough Board meeting. So you have both minutes have been emailed to you. Do we have any corrections, any comments, any edits on the minutes? Hearing none, do I hear a motion to adopt the November 19th and November 30th minutes?
Move
We
to
have a
adopt.
motion from James.
Second.
We have a second from Christine Berthet. All in favor, say aye.
Aye.
Opposed? Abstentions? Hearing none, the motion passes. The first order of business, we have a presentation, which I'm really happy that we have this presentation because the world is full of acronyms sometimes and it's all inside baseball. And you might have been hearing a lot about DISRIP. Well, I don't even know if I'm pronouncing it right, but it's something that's garnered a lot of conversation nationally. As we all know, the healthcare industry, healthcare costs are around 1/5 of the federal budget. It reminds you of the quote, a billion here and a billion there, and soon it starts to seem like real money. But we're going to tackle some of this big behemoth in terms of our economy. So we have a presentation of the Delivery System Reform Incentive Payments Program, and we have the presenter Moises Perez Martinez, Director of the Workforce, Community and Government Relations for the Advocate Community Providers, PPS. And for full disclosure, I know Moises dearly for actually, when you talk decades, that's pretty wild. But almost 3 decades. He's a mentor, he's a great leader, he's a friend, and we're very happy to have him here this morning to present on this topic. Thank you. Floor is yours.
I'm just going to bring our CEO, Mario Paredes, to start the presentation. Thank you, Moises.
Good morning.
Morning.
My first words are of appreciation and gratitude to the Borough President for this invitation and the opportunity just to give you a very general overview of this new initiative. We are in the midst of a real reform and transformation of healthcare in the nation, and particularly in our state. And we have been created as a non-for-profit organization to address the healthcare system in the city with particular assignments. Moises Perez, who is one of the leaders of the organization, he will be guiding you through what is ACP and how we are responding to the mandate of the state of New York. And all the details will be in a very short presentation, so you will have insights. And hopefully, we will be able to collaborate with the Borough President and the staff that serve the Borough President as we move forward. We have 5 years to meet very specific targets in the city of New York. So just thank you for giving us this opportunity. Thank you for listening. And may I also briefly introduce the Chief of Staff of ACP, Mr. Alex Damiron, who is here with us, and Josephine Wu. She is the Director of Operation of ACP, and we have a representative of North Shore, the representative of North Shore is helping us to shape and give form to this non-for-profit. It will become a very large organization. We envision over 1,000 employees in order to meet the mandates of the state of New York. We will be inaugurated officially in Manhattan on 35th Street and 8th Avenue. We just completed arrangement to have an entire floor where we will house our new staff. And also I want to introduce you Tom Millian, who is the Director of Communications for ACP, and my colleague here, who also will be in charge of the explanation of what is this project. Without further ado, again, thank you so much for hosting us this morning.
Thank you, Mario. Thank you again for giving us this opportunity just to explain to you guys a little more about what's ACP and what we're doing as part of the district program. Please. So the Delivery System Report Incentive Payment Program. These are some of the keywords that for ACP come to mind of what we're doing. We're trying to impact, transform, integrate the delivery system of how we provide healthcare in the New York City area. In New York City, there's 12 PPSs, which are part of the 25 that were considered throughout the whole state. In the Manhattan Borough, there's only 5 that cover the Manhattan. In April 2014, Governor Cuomo announced this initiative where $6.8 billion were allocated for this program. The program, it says, is a transformation of the healthcare system here in New York City, especially for Medicaid population, but focus it in collaboration with CBOs throughout all the different boroughs and areas to make sure that we extend the services to our Medicaid population the right way. Like I said, ACP is one of the 4 district networks in Manhattan and one of the 12 in New York City. Total throughout the state is a total of 25. District is just focusing on the triple aim: better care, lower cost, better health, and trying to reduce avoidable admissions by 25% in hospitals. Let me make a stop here. This initiative was made initially for hospitals, but we are the only PPS, which is physician-led, not just in New York City, but in the country. What that means is a group of community physicians took the lead to put an application together and actually became one of the largest one, the second largest one next to the HAC hospital system. We got assigned 640,000 patients to contribute. We're talking about physicians from Upper Manhattan, Inwood, Washington Heights, Harlem, Lower Manhattan with Chinatown. We have Koreans, and we also cover a lot of what is the Bronx, Queens, and Brooklyn. Important components of the district. It's try to connect all of the physicians with the specialists, with the hospitals, to make sure that there's no duplication of services. There's no so we could be able to close all the gaps of our patients. If a patient is seen today by Dr. A and is referred to Dr. B would right away be able to see the exams and test results that Dr. A already assigned. That way we do not have to go again and make another appointment for more tests and actually produce another charge to the Medicaid offices. Alert physicians right away when the patients hit the ER. This way we can make sure that a follow-up is immediately assigned. That way the continuation of care continues. For some systems, like I said, full integration with electronic record, and this included this new initiative called Rio, which is that all the documents of the patients are in a cloud that patients will consent So that way, if a patient is here today and it goes tomorrow to another hospital, another physician, they will be able to pull out this information automatically, and they will be up to date. Okay, so we have chosen 10 projects. And 10 projects, we came to conclusion based on our community needs assessment that we did of the 4 boroughs that we actually taking part of. So integrated delivery system is the interconnectivity of all of the physicians. Health home at risk intervention program, ED care triage, care transition, integration of primary care and behavioral health services, which is a key one because we're seeing a lot of issues nowadays in New York City in regards to behavioral health and mental issues. Cardiovascular disease management, diabetes management, asthma, tobacco use cessation, increased access to high quality chronic disease prevention, care and management in both clinical and community settings. This is just a little graph right here so I could more or less give you how big ACP is. Right now we are 1,700 physicians. If you can see in Manhattan we have 379. These are mainly primary care doctors and specialists. If you see Brooklyn, Bronx, Queens, we have a big amount of other providers. 122 other providers. This involves CBOs, skilled nurse facilities, health homes, HMOs, you name it, hospice, we have it. We're trying to create a complete network so that we could make sure that we provide our patients the right care. Attribution, like I said before, we got assigned 644,000 Medicaid lives in our network, and this is the attribution. In Manhattan, 60% of our population is in Manhattan, and the fact that it's low is because in Manhattan there's another 4 PPSs working in collaboration in the borough of Manhattan. ACP was received a total valuation of $700 million. This doesn't mean that that's a guarantee because this will be based on milestones and hitting some type of metrics every time for us to get the necessary amount of funds. Guarantee for participating, it says $174.8 million, but the rules of the game have changed now. Those are based on metrics too that are going to come through the HMOs and based of us working together and closing gaps in our patients. And now I'm going to let Leo Perez talk a little more in detail about the Manhattan Borough and the findings that we had found doing our needs assessment.
Thank you, Alex. First of all, thank you very much for having us. And I'm glad the meeting is being recorded. That way my parents can see me in action from their home.
That's most important.
So I'll talk briefly about some of the assessments that we've made about the health needs here in Manhattan. But before I get to that, I just want to briefly explain how we started, because our medical providers are, as Alex mentioned, found throughout the 4 boroughs. So Manhattan, Bronx, Brooklyn, Queens. What we did was we tried to look at Medicaid recipients and several indicators, including hospitalization rates, ER visits, to try to determine what zip codes have the highest severity of health conditions. And from this methodology, we identified 29 zip codes. And just briefly to say that out of the 29, 15 can be found in the Bronx. So clearly the Bronx is the sickest borough, so to speak. But out of the 29, we found 4 to be located in Manhattan. And these are found in neighborhoods from East Harlem, Washington Heights specifically, and Chinatown as well. So, and I just want to give a brief snapshot of what our Medicaid recipients, the ones that are attributed to our medical providers, and where they can be found. And from this map, sorry, just go back briefly. This is pretty self-explanatory, but the redder the area, then the more of a hot spot it is, right? And here, conversely, the darker the blue, the more patients are located in these areas. So as you can see, a lot of our patients can be found here in Washington Heights and Inwood, right? But we do have a significant amount of patients in Chinatown, area code 1002, and East Harlem has a significant amount of ACP medical recipients as well.
Could you go back on the page before?
Yes,
I don't
of course.
understand what is the page before then in red. The dark red expresses what? The dark red.
Okay, so we've developed a methodology to determine, to look at severity of health conditions. And by that, I mean the rate of hospitalization rates, ER visits, and also the percentage of the population under Medicaid, right? So that last one is sort of a social determinant of health, correct? And so from these indicators, we've developed a methodology to identify the areas with the highest health needs.
So red is not good news.
Right.
Okay,
But
and
just,
so I was
just-
therefore wondering why the
You're-
red
You're missing like a neighborhood.
it seems to be my
Yeah.
district is not showing on the next page. I was not.
Oh,
So-
of course. So the next page refers to
their
the
patients.
concentration of ACP Medicaid recipients.
Okay.
So those under our medical providers. So
Yeah. The red map is just citywide. This is ACP.
that's correct.
Get it.
And again, this is not.
But in the red map, you have, what area would you say that is?
Is the Health
Chelsea?
Kitchen on the left?
Hell's Kitchen. In the lower part of Manhattan toward the west.
Correct. And actually,
So
that's
not mentioned as.
correct, and-
there's
and-
Chinatown and East Side, but
This is
not.
where you're
correct.
going to have your
And
headquarters.
that's a very good point that you bring up, because one indicator that I left out here is that we've also, in order to determine the areas where we can cause the biggest impact, we're also looking at the areas and taking that into consideration where our ACP medical recipients are,
Oh, okay.
right? So if we're not mentioning this area here, it's because we have a significant lower amount of patients, and thereby we've determined that we can increase our impact by focusing on the areas found in East Harlem, Washington Heights, and Chinatown, Lower East Side.
Okay.
Does that answer your question, sir? So once again, you got, everybody has some of the estimated numbers here, and you can look at the number of ACP patients yourself in this area. So our next step was to look at prevalence, and to look at, again, our three hotspot areas: East Harlem, Washington Heights, and the Lower East Side and Chinatown, and how they compare to citywide in terms looking at different health indicators. So child asthma, smoking rates, rates of obesity, of diabetes, hospitalizations, alcohol-related, drug-related, psychiatric hospitalizations, stroke-related, etc. So from this area right here, there's a significant amount, for instance, of smokers. There's a higher amount of diabetes rates in Lower East Side and Chinatown. Washington Heights is a significantly higher amount of hospitalization due to stroke, and also rates of diabetes are a little bit higher there than the city average. But it's really East Harlem that's the most striking, because if you look at all these indicators, East Harlem is very much higher than the city average. Again, but we do have a lot more patients in these two areas here, but we could not overlook this area as well, because we have about 3,000 we estimate, and also this is clearly, an area with higher needs.
I have a question.
Yes,
I
please.
see East Harlem and Washington Heights and Inwood, but on the other chart with the zip codes, I saw a lot of Central Harlem zip codes. Is that combined in those two?
No,
Because-
East Harlem looks at zip code 1029.
Yeah, I saw like
Exactly.
30, 27, and a couple of those are in Central Harlem.
Correct.
Which I think is a high rate also of, issues. That's why
Correct.
I'm wondering, is it combined between East Harlem and Washington?
Not in this,
Or it's
not in
in
this,
the
but
chart
that's,
at all?
again, that goes back to the point the gentleman made, which is that These are also areas that have a significant amount of ACP Medicaid recipients.
Okay,
Where we
got
can,
it. Sorry, thank you.
No problem,
Thank you
of
for
course.
clarifying.
So I'll just point out a few of the indicators related to East Harlem: alcohol-related hospitalizations, drug-related hospitalizations, and psychiatric hospitalizations, for instance, are very much higher. So 2,000 compared to the city of 684, 2,800 compared to 900, 2,300 compared to 1,000. This points to mental health is an issue in East Harlem. These are all related to me. Go ahead,
I have a
please.
question because do they do any analysis given the fact that we also have the highest concentration of shelters and drug programs and how that affects the numbers?
Well, that's a great question. So in terms of attribution, determining where our patients live, we looked at the addresses, right? The zip codes.
Right.
So these are where our patients reside.
Right.
Right, not so much. So for as you know, our Medicaid recipients can go pretty much anywhere. Exactly.
Right.
Exactly.
That's
so,
why I asked the question.
So for these, it's where they reside. That's how we determine the numbers.
But the other slide, the one that you were showing.
These look at Medicaid recipients.
No, that one. This one here, the Manhattan.
Exactly. These actually, these numbers are not just for Medicaid recipients.
Right.
Exactly.
That's what I'm driving at.
That's right. That's correct.
It could be also because being that we do have a lot of drug programs, they're transient. They're not there, but if they get sick, they are going to go to the local hospital.
That's a great point.
Right.
Thank you. Thank you very much. Anybody else have a question?
I know you just mentioned 3 items, and both of those address mental health. Would that be covered under the integration of primary care and behavioral health that you guys reviewed?
Correct,
Yeah.
sir. And also, if you look at all these health indicators, they all relate to our projects. So that's why we picked them out as well. Go ahead.
First, I want to say thank you,
Thank you
for providing this service because many people do need it. I have just a few questions. One was about how do you address the Medicare gap? Because there's quite a few people that are on Medicare that don't qualify for Medicaid. And do you address any of that in this program?
Go ahead.
So I would answer that question. So this program in particular, it's for Medicaid population, but we also have what is called the dual patients. We have Medicare and Medicaid. Those are part of this program as well. But the initiative overall is for Medicaid. However, we are a physician-led group. So what it does, when we implement something, we just don't implement to the Medicaid population. We implement it to all the patients that come through our doors. So we're talking about 1,700 physicians caring for Medicaid and Medicaid population, and the services are going to be provided throughout, the same services throughout.
Thank you. And then the other question I had was, as it relates to cancer care, I didn't see anything, any indication on here about cancer treatment or cancer care or prevention of cancer.
Do you want to handle this one?
And we have a very high rate right now.
So if you go back to the project slide, over, right there, when it comes down there, it says increase access to quality chronic disease preventive care and management in both clinical and community settings. This is when cancer falls in this program.
Okay.
We make sure it's not just cancer, but every type of chronic disease falls into that category.
Okay, and the last one was the behavioral health. Are you addressing any needs of children with mental health issues or behavioral issues?
Yes.
Correct.
Okay. Thank you.
Thank you very much. So, that being said, I'll pass it to my colleague, Moises.
Well, I think you understand that what's happening in healthcare is actually exciting. And if you've been around, for a while and you've seen all the different changes that have taken place over decades, this is really exciting because it really is about re-engineering relationships and moving from episodic care where people just wait until they have to rush to an emergency room or on the case of cancer, for example. One of the biggest problems is testing. Most cancers, are treatable if you detect them early enough. So we're promoting testing so that people can start taking care of that. And the process of re-engineering and moving the scene from the hospitals to the primary care providers in the community, all over the city, is really the task, that we have, and so that's why we're reaching out to you. We want to first of all, we wanted to come and present to you what we do, and then to go back and have individual meetings with you and talk about your communities, the systems that are in place, the key organizations, and the manner in which we can pull things together to really provide a care for patients that is comprehensive, that is holistic, and that anticipates issues instead of waiting for people to sort of, fall into the laps, of the hospital systems. And in that way to improve care and maximize the ability of our system to support the community. So we want to hold community events, forums, we want to educate people, increase their level of literacy, their understanding of how the system works, the role that they play. We want to speak to people about the importance of managing, if they have a major illness, and the kinds of resources that can be brought, to bear, in that situation. We want to develop engagement activities and coordinate the work of public agencies. A lot of public agencies, as you know, sitting on the community boards, do not really talk to each other. They use different languages sometimes, and people just don't, they're not in the same sort of, at the same level, so to speak. So that's going to be a major, piece of the things, that we're going to be launching. So don't be surprised, and we'll start with the hotspots. And let me just say one thing about the hotspots. If you notice the first map on the hotspot, the entire city of New York is a hotspot. And while, we're zeroing in on the hottest of the hotspots, quite frankly, there are pockets everywhere. This is Chelsea over here. Now, Chelsea is not a poor community, but they have public housing.
And Hell's Kitchen, don't forget.
And Hell's Kitchen, right? But they have public housing. So that's why these numbers kind of surge in that way. Wherever you have public housing in New York City, you've got issues. And we need to sort of penetrate that system and begin to work it, in a much more effective way. So we're going to be coming out to you. We're going to leave our business cards. We're going to collect your business cards and really begin to have serious conversations about how we can link populations in our communities to their local primary care providers. We're asking everywhere we go when we sit down with patients, who's your primary care provider? Because that's almost like you have to be able to answer that if you ask somebody, what's the name of your grandmother or your grandfather? They'll be able to say, yeah, it's so-and-so. And that's a big part of what we're trying to do in terms of highlighting the new changes that, that are going to be taking place in the system. Somebody have their hand?
Hi, this sounds so exciting. I have a couple questions. So, are you working with HHC, Health and Hospitals Corporation?
We are.
So, how can you explain to that? Because I sat for a while on the Gouverneurs CAC, Community Advisory Board.
There are 12 PPSs, performing provider systems, in the city of New York, 25 throughout the state. And the operating principle for all of the PPSs is really collaboration. That's really what it's all about. For the first time, collaboration gets a premium. So we're working with HHC and all of the other PPSs in order to coordinate all the things that we do.
But I guess I'm trying to figure out how you're working with them. So your patients go to HHC? Or
Yes.
That's, okay. So in terms of records, who maintains the records? HHC would maintain a record, or your organization ACP would maintain the record?
You want to take
I'll
that?
answer that. So like Moises said, we're collaborating with all the PPSs with our major, mainly hospitals. Let's say we have Mount Sinai, we have HAC, we have New York Presbyterian, and in our network, our hospital partners in our network are the North Shore, LIJ, and the Medessa system in Queens. But that doesn't mean that our patients go there. Our patient goes to Montefiore, our patient goes to Presbyterian, our patient goes to HAC hospitals. So what we mean by collaboration is the integration will flow throughout, meaning if my physician sees my patient and the patient then ends up in the ER or it ends up in trying to be admitted, the ER will see the record of the patient and make sure that they see the live record of this patient of everything that he has gone through. And the same way, if the patient goes to our hospital, to one of our physicians, and he already was prior admitted to an HAC hospital, we'll be able to see what happened at the hospital type. And to your point that where this resides.
Yes, does someone sign up with you, or, I guess I'm confused,
Right,
because the
so we
whole
don't-
health insurance thing.
We don't get signed up. So all these Medicaid patients, they either have straight Medicaid or they have already an HMO that provides services to them. We are an extra layer on top of that to make sure that we coordinate the services and close some gaps that the HMOs have not been able to close. So we're gonna provide another
Like what
extra
gap?
service.
Let me take another crack at it. Every patient has to be assigned to a primary care provider, and that's their base. And that primary care provider is responsible for coordinating the care of that patient. We are now, all of the PPSs are now working out complicated legal agreements to facilitate the share information that requires, patient consent and so on and so forth. So that when a patient, for example, goes, say, to whatever hospital, because, you may be in Queens, and if you're feeling really terrible, you're not gonna go back to the Bronx or Brooklyn in order to get treated. That hospital has to open the system and every other primary care provider so that the patient information is shared equally. But it is the right and the, not the right, but the responsibility of the primary care provider, your doctor, to coordinate your care, and that's your home base.
So, also, you probably, everybody, at least Community Board 1 and I know CB2 and CB3 has been very focused also on the Zadroga. So how, which is the 9/11 environmental health exposure, which HAC has been phenomenally, working on that, and again with Montefiore and everything. How does that get involved with your program?
So, you see, these are the projects that, based on our needs assessment of the community where we serve, that are the high risk of what we.
Because what they found, because I'm also on the World Trade Center STAC, the Scientific Technical Advisory Committee, I'm on the World Trade Center Health Registry Committee, I'm also on the Survivors Committee at HHC, and so it's not only the physical, but it's also the mental ramifications of their exposure
So
14 years
here's how
ago.
it works.
And it doesn't, and for some of the mental exposure, some of the issues that are exposed are issues that fall on your chart, like asthma. It's not necessarily a regular asthma, it's a special type of asthma. Or it could be the drinking, or it could be other substance abuse.
That's why this program
But-
focuses tremendously in the integration of primary care and behavioral health. There's a lot of attributed funds into that category because of the severity of these issues that you're commented and in here, specifically in Manhattan and throughout the city. There's a lot of funds dedicated to that, and we're trying to, like Moises said, there's a target that we have trying to focus on as well.
But if they're on Medicaid, they have a primary care provider, and the network they get assigned to is the network that primary care provider is involved with. So any of those patients, that have doctors in our network that are being treated by them, they become part of our responsibility. And then the doctor has to provide comprehensive care. There's the approach, technically called patient-centered medical homes, which means that the doctor has to provide holistic care and look at the total person, the complete individual, not just physical health, but mental health, and take care of the entire family in the process as well. So it's really revolutionary, quite frankly.
Well, I have a comment all the way in the back.
Can
and
you
I have
actually describe how you
Henrietta, and then-
recruited your physicians into your network? And secondly, also what kind of training and relationships you have ongoing to kind of implement these kind of things? Maybe that might help give us a better idea of how you're.
So we didn't recruit our physicians. This organization came together for already IPAs and ACOs that were formed in the community already. So we had around 6 or 7 IPAs, and they came together to form this ACP organization.
And an IPA
is an independent physician association.
Oh, got it.
And ACO is a accountable care organization. The ACOs are for Medicare patients and rules, but IPA is an association of physicians and through New York City. And just to go back on something that Moises said, before the patient, the doctor will see the patient in their offices, and then the patient will leave the office and that's it. Right now, what we are promoting, and it's the transformation. So the patient comes, but we're trying to follow that patient 360 and make sure that everything that patient goes through, we know what's going on with it. And make sure that the coordination of care continues.
That kind of leads into my question, the integration of everyone in this system having all the records. That's a major project. Do you have a major technology team? Because my example of that is I go to Beth Israel on 14th Street, and they have a facility on 15th Street, and they, for the last 4 years, they haven't been able, even though they say, oh, we're integrating, you know, I have to carry, if I don't carry my records, it's just not in the system. And so I'm just giving that as an example of, here's an organization, one organization that can't get it together. I love them, but the records don't make it into the system. And so this seems to be a major piece with someone just going to a doctor or a Bill's facility in Queens, in Brooklyn, and the records are going to appear. And if that happens, this is incredible. But that is a major piece that has to be really worked out. You know.
Right. So if you see a #1 project, and there's another project that has a lot of attributed funds, it's to make this transformation and integrate all this system. However, there are doctors and there's places that maybe because of their approach would not want to engage in being so technology savvy. They prefer more an old style of medicine, approach to medicine, and maybe they would not transform. But overall, there's a lot of funds attributed to make sure that we get interconnected. And yes, we have a good IT team that are trying to put together this initiative.
Great, thank you so much.
And all of the major electronic medical records companies in the nation, this is a nationwide trend, really have closed systems. There's a lot of movement in Washington to force them to open up and to become interoperable, meaning that they must now share information with every other system that is available there, so that if you have a pharmacy, for example, that is using one system, it has to be able to communicate with the system that is being used by the doctors, by the hospital, and so on and so forth, so that the information about the patient gets shared, and you can provide more quality, better quality care in that way.
Thank you so much.
Thank you. Christine Bertay, and then I have you next.
I'm always very confused by healthcare stuff, so I'm sorry if I sound I'm going backward, but so what is it that you deliver that nobody else does?
What is it that we do?
Yeah, what is unique to your proposal?
We are
that nobody else does. That, like, if I have a doctor, let's say I am on Medicaid, I have a doctor, I have a hospital. How do you get involved in my life?
So let me go back again and say we cannot approach a patient and say, oh, become part of our network. We get the patient get assigned from DOH to us.
All right, so I was assigned to you. What happened to me?
What do you mean? To the doctor?
No, I was assigned to whatever your
What
network.
happened to me?
To your
Okay,
your network.
Exactly.
So I am now on Medicaid. I'm assigned. My number has been given to you.
You're
what
assigned,
happened differently from what yesterday happened?
So you're assigned to us because you've seen one of our patients.
No.
One of our doctors. I apologize. One of our doctors.
Right.
Once you see one of our doctors, you're assigned to us.
Right.
And then the coordination of care starts with ACP.
So what you do is the coordination of care.
Correct.
Between different things. Okay. So thank you. That's helpful. Now, second point, coordination of care. One of the things that seem to be the most difficult. You're saying you want the patient to be covered, to be preventive, and 360-degree. One of the major issue is coordination of appointments.
Correct.
And scheduling all the appointment in one day, so you don't have to miss 5 or 6 or 7 days of work in order to see doctors. So what are you doing about that?
So one of the things is we're gonna have a center that follows the patient. We call the patient, get the appointment for the patient, ask about transportation needs to get to your appointment. We will facilitate those, the arrangement of those. Also, Medicaid patients move. Maybe the phone numbers that we have in records are not correct. They changed. They don't have money to afford a cell phone anymore, so they don't have a cell phone that was provided. We have what we call community health workers that will be out on the street locating these patients to coordinate this, make sure that they go to their appointments and they follow up.
What about coordinating the appointment between all the providers so that they are all in one day?
So as soon as the patient goes to the physician and the physician will say, oh, you gotta go see a cardiologist, right there and there, the patient will leave the facility with an appointment. The coordination service will follow up with them. Okay, you have an appointment.
I'm asking the same day. Who is going to make sure it happens in the
Well,
same day?
as part of the PCMH recognition, which is Patient Medical Center.
No, but that's part of that.
There is every physician needs to have what is open slot for patients' appointments the same day.
So is your system going to schedule it the same day?
Yes, we're gonna coordinate for the patients to go. If it's needed, an emergency to go the same day, yes, it will.
Okay. So that would be helpful on the charts.
Because I relate to that.
Christine, so I'll try, because I think your question is what makes ACP different, is that correct?
Yeah.
So here's a couple of points. The first one, we are community-based. So location is extremely important, especially when, so that's one. And that leads to my second point, which we are culturally responsive. Most of our medical providers come from the communities that they serve, right? It's from the same culture. So they're able to engage very effectively. Also, bear in mind that in terms of health disparities, overwhelmingly they disfavor minorities and foreign-born groups, etc. So that's also why we are in a unique position, right, to address. The third component that I want to bring up is we are PCP-led, so primary care providers. Sorry?
I say I don't know what that means.
Oh, okay. So primary
nuts.
care providers, right? So primary care providers who are pivotal in the health system because they're the one who, as Moises said, who coordinates care and then look at, so whenever you have something, you go first to your primary care provider, and your primary care provider then can provide a referral to a specialist, right? So the reason why I mentioned primary care providers is because part of our program is also to improve the services that PCPs provide. So this is why we've mentioned PCMA certification, right? We're trying to transform this medical office into patient-centered medical home. And this goes up to your question about access, right? Patient access. Because it's actually the first standard of PCMA certification is this patient access, where patients can make same-day appointments, right? They're able to look at their electronic medical records from home, right, etc. So these are the issues that PCMA certification and we're trying to drive.
We only have like 1 minute left, so I wanted to get in two more questions. I know Padmore, and then Catherine, and then if you have.
Well, I mean, I know that the larger district is about reducing costs. It was Medicaid costs, there's a lot of Medicaid fraud. Part of it was that if you can decrease the cost, you decrease readmissions, decrease retests, and stuff like that.
And improve care.
And improve care, improve outcomes, that is eventually going to decrease costs. I know there's a lot of systems that are doing this. Mount Sinai, we just went to a forum yesterday by Mount Sinai, providing that pretty much something similar that they're doing, so looking to decrease costs. So I know it seems like you're taking it from the primary care provider and going up, and I presume stretching out long-term care facilities, nursing homes, and I would presume eventually hospitals, not sure. The thing is, how well are you able to ensure that information is being updated regularly? Because I think that's the most important thing. If a doctor is not aware that a patient has been for a particular test and they're going to go do that test again, it defeats the whole purpose, and being able to continue to follow. So we just want to get an idea of how well you'll be able to perform that and really be able to address outcomes and ensure that patients are driving down costs. And I presume that some of that cost is going to be coming back to you once that you're demonstrating that some of these the outcomes are being improved.
Correct. So one particular point is our PCPs are mainly part of 2 electronic medical records. So what does this mean? we are already now finalizing contract with those two companies that they're gonna integrate our network completely.
So everyone is gonna be on the same network?
Correct. No, we have two.
Two of them,
different
either
ones.
one of them.
They're gonna be connected, all of them, and then on the top, we have a main one that's gonna flow, all the charts gonna be flowing, and all the information necessary will be flowing on top. So that will address the interconnectivity. However, we are in the process also to developing systems that will connect with long-term facilities, housing, different CBOs. Because this is part of the first project, which is interconnect everybody that is in our network and make sure that the communication flows. That way we could save some duplicates that already happen.
We're building the spider web.
It's not an easy task. It's not an easy task, and I can say that it will be built tomorrow, but we're working on it.
We have to get to the community chair update, so if Catherine, you
I'll
can be
be
really
real
quickly,
quick.
and then George, if you could be really
So-
quick.
I love what you said, sir, about engaging in a culturally responsible way. Because that- responsive way, which is really important and is community-based, because that seemed to be the way to get people to get in a timely manner for care for 9/11 health. So I think that's really important, so it breaks that barrier of access. I was wondering, just taking it one step further, if you're gonna be looking at the big data and you find these hot spots of where different things can be done, whether it's air pollution, on Canal Street or up in Harlem or something like that, to even prevent people from getting in that position of being hospitalized in the first place.
So as an ACP, we picked this 10 project. However, we are also seeing what other areas are affecting where our population is. And yes, we are going to embrace changes in education and whatever it needed to make changes in other areas that are not exactly what we picked for this project. Because I know that this will also change throughout the year.
These are projects and areas that we love to work at the community level with folks, and sort of pull together.
And so all the numbers that you saw in terms of our patient attribution, these are still estimates at the moment. The full attribution list we receive from the state next year. But still, we are on the ground, right? We're still moving forward because we do have a provider base. In terms of your other question about addressing, I think the social determinants of health, right? This is why we're here. Right? Because we need to create this connectivity. We need to work together. When we get the data on prevalence, right? Prevalence looks at characteristics and the prevalence of diseases, right? Then we come back to you and look and say these are actual prevalence rates with regards to our patients. How can we work together to address some of the wider issues, such as air pollution, and so on and so forth.
I just want to note that we were joined by CB7 Chair Elizabeth Caputo, and then we were joined by CB12 Chair George Fernandez, who now has a very quick question.
Oh, just one question. Good morning, everyone. How you doing, Mr. How are you? Just one question. Will ACP help reduce the visits, like in our district? We have an overflow of non-emergency medical, should I say, situations, or the overflow in emergency. Will that help reduce Columbia and New York Presbyterian in our area, reduce those numbers?
If we don't reduce those numbers, we fail.
That's not what I'm asking.
The answer is yes.
Is it going to help direct them to urgent care facilities and their medical or their PCP as opposed, oh, my chest hurts, now they're in the emergency room, and that cost is thousands and thousands of dollars to the hospital versus they can use their,
Direct them to the PCP, not to the urgent care, but to the PCP. The name of this game is the primary care provider. That's the role that is being highlighted. That's the key role. And that's why our network, quite frankly, is powerful, because we have 1,700 physicians spread throughout the city of New York. We had a map in the package that sees the distribution. So that's the idea. And to work together, the primary care providers, the community-based organizations, the hospital, to achieve that goal is really the purpose of this.
Thank you.
Thank you. Thank you so much for the presentation.
Thank you so much.
Next, we go on to Community Board Chair report outs. We'll start with Community Board 1. Catherine.
Thank you very much. It has been another amazingly busy month, so please bear with me for a minute. The most exciting news is that the renewal of the Zadroga 9/11 Health and Compensation Program, it is included in the omnibus bill, which finally made the budget the other night, and it should be voted on tomorrow, Friday in DC. But we always need to wait till it actually goes through, and that has been, over a 14-year battle. And it extends the healthcare for 75 years. It's a major win, and there's many people to thank. I personally, in this last month, I've been to DC twice, and there was a big press conference where all our elected officials were there. Another big item is at the South Street Seaport. Chris Curry from HHC came to our Seaport Civic Center committee to provide an update on 3030 Peckslip, which was known as the Seaport Best Western. It was purchased by HHC in bankruptcy court. It has yet to close. And at our meeting on Tuesday night, he also said that the former Fulton Fish Market at the new Market Building site, that sits right underneath the FDR, will become a commercial building. So we don't know the specific details on that. It will not be a luxury condo tower building, which had previously been contemplated. 3, the crossing guard situation continues, and there have been, DOT has made improvements at both Peckslip and Spruce Street, and a big win is that along Route 9A, something we've been working on for years, between VZ Street and Liberty Street is finally opened up to the pedestrians and the bikes, so they don't have to go through Battery Park City. The biker, everybody's thrilled, and you can also cross at Fulton Street has reopened between Battery Park and the World Trade Center site. And one thing that I think CB2 and CB3 might be interested in, I was at a Senator Squadron's Worth Street reconstruction project, and because of all the construction downtown related to 9/11, there was first the Lower Manhattan Construction Command Center. It was shrunk, and then there was something called the Lower Manhattan DOT office dealing with coordinating the construction projects. It will be phased out in March. And I went through and counted. We still have 90 major construction projects in 1.5 square miles. So we're very worried that when this gets taken over by the Manhattan Commissioner, that the same continuity and care continues, because that means projects can take longer and cost more and cause more quality of life issues. I mean, the fact that, for example, next to Spruce Street, the traffic light was oriented the wrong way, which impacted crossing of children to their schools. I also wanted to say that yesterday, for the first time in a very long time, the Battery Park City Authority had an open community meeting. It was a good first step. There's still many more questions. The PEP issue continues to be unresolved and outstanding, and we clearly need more representation of people who live on that board. And I want to let other boards have the opportunity to speak. Thank you very much.
Community Board 2. CB3.
Yes, good morning, everyone. My name is Alicia Lewis Coleman. I'm here for Gigi Lee this morning, and she wishes everyone happy holidays. Okay, we have just a few things to report this morning. The first thing is CB3 had 2 town hall meetings this month, and one was on arts and cultural resources, and the other was on the intercity bus situation. And the borough president was able to be in attendance for both, and we thank her for being there. Last week we had land use committee, and the committee passed a resolution requesting that the EDC rescind the RFEI because of a lack of community engagement. Recently, CB3 was experienced a few instances of EDC releasing procurements without significant consultation with Community Board 3, and this is becoming an issue with the Community Board. We're having a hard time dealing with that and getting them to communicate better with us. So we would like some support in that area.
Is on SS Street Market the RFEI?
Yes.
No, this is
no,
different.
this
This
is
is
a
different.
different
Yeah,
RFP.
well done. We've been working on it with Councilmember Chin's office, so
Okay.
we certainly have heard the concerns of the community board and have been coordinating with Councilmember Chin's office to respond to it. So, there's a letter. Vincent, did you want to?
Sure. So I'm Vincent with Councilmember Chin's office. Our office, along with the Manhattan Borough President, sent a letter to EDC to ask for more time and more site visits, so the community has a chance to check out the area and check out some of the projects that could be happening in the space.
We'll make sure you get a copy in case you haven't gotten a copy already. Maybe you'll get a copy by the end of this meeting.
Okay.
Yeah.
And then EDC actually agreed to extend the public comment until February the 1st, after hearing from the community.
Thank you.
CB4?
Yes, so we had a victory this month. The Hudson River Park had initiated an RFP to put a beer garden in one of the piers, which was one of the quietest pier where everybody loves to go. And we mounted a pretty aggressive rebuttal. And finally, the applicant, as well as the Hudson River Park, backed off and agreed to let that area to be a quiet part of the park. And that leads us to 2 points. One is we're very concerned about the commercialization of the park. Really, like every pier has an alcohol license and music and noise, and it's not clear whether it's a park or it's an amusement park. And I think we need to really be vigilant on that. And the second thing is that same issue as you're mentioning with EDC, then they just issued another RFP without consulting with us. And it has become just a habit. I mean, this is built in their mode of operation. It's like sending RFP and say, oh, by the way, we did, here it is, and then we have to push back, and then we have that tense relationship rather than engaging the community up front and saying, well, what do you want on the park? Where are the ideas? What's the community would like? And let's put an RFP based on that. So, I mean, I would not mind having some help on that.
What was the RFP?
The new RFP is on Pier 76, where the stables,
Commercial.
the stable, I'm sorry, the NYPD stable, there are NYPD stables, right? And
That came from
Right.
CB1, some horses went up
and
there.
then they moved in another rezoning, etc. They moved from this location to another location we found, right? So now that space is empty, and the question is what to do with that space until you can redo the whole pier, because the rest of the pier is a tow pound. So that's a major issue because nobody knows what to do with the tow pound. But let's say you have a space like that, it would be good to have a charrette with the community and say, what do you want? And it doesn't happen. And it's everything, like they have peer, what can I say, peer, events, very noisy. And we learn of it like the last minute. And so everything is backward, let's put it this way. We really need to change that process so it becomes a proactive consultation of the community well in advance of the scheduling and the programming of the park.
Sure.
So that's one.
Christine, just on that, you mentioned EDC, but you're talking about Hudson River Park.
Yeah, I'm talking about Hudson River Park. We managed to get EDC to talk to us, so that's good. We feel good about it. Second, we had a beginning of a mini task force between CB6, CB5, and CB4 to look at the M23, the 23rd Street crosstown bus, which is slated to become a select bus service. And based on our old experience on 34, we put together a little group to manage that, and we created a resolution that we are all trying to sign to get approved, to send to them to say these are the things you should be considering across the board. So we are coordinated as board when we respond to them, so I'm very happy with that. And a third issue is that we had a hearing about the 6th Avenue bike lane, 6th Avenue from 14th Street to 23rd Street, or maybe from 8th Street to, a little below 14th Street to 23rd Street. And we didn't reject it because we love bike lanes, but we indicated to the DOT that there were not enough pedestrian safety features to make it, good for everyone. And therefore, we asked them to go back and study. Now, linked to that, we had last night, a presentation by MTA to split the M5 into 2 routes, so that would improve the performance. And the bottom line is that there's too much traffic. So instead of working with DOT and trying to put a bus lane on 6th Avenue, which is also being looked at for a bike lane, they are just going to split the route. And so we expressed concern, and I don't know what could be done, but I mean that 2 agencies are looking at the same stretch of 6th Avenue, and they are not coordinating to maybe say, on that stretch we should do the right thing, do all the lanes, etc., is a little bit disappointing. And last but not least, this is my last Borough Board meeting. I am term limited. We have 2 years term limit in CB4, so I wanted to thank all of you. I've been learning a lot and enjoying and really appreciate all the being honored to work with you, and I'm never going to forget that time. So this is really wonderful, and I hope we'll continue. I will be back to the chair of Transportation Committee. So you'll hear about me. And the new chair is Dolores Rubin, who is starting in January. So thank you so much for everything.
Thank you so much.
Thank you.
Sad, but necessary. CB5.
Hi, everybody. I'm Eric Stern. I chair the Land Use Committee. I'm here representing Vicky. I guess, it wasn't planned to discuss this, but, we also had the Department of Transportation come before us with the proposed kind of Safe Streets redesign for the portion of 6th Avenue. We submitted a resolution in support. I believe we were the first board to ask DOT to study a complete street redesign for 5th and 6th Avenue. I think we beat you guys, I think we beat you guys by like a week or something. But we've been working on this for a number of years, and so we're really happy to see DOT come back to us, and we think that there's room for improvement. But we're happy that they're moving forward on this, and we ask that they consider future expansions of these proposed changes. Two points. One is, you were speaking about the privatization or commercialization of park space. In Community District 5, we don't have many parks, we have a lot of plazas. Right. And so I don't know if any of you saw the article in the New York Times in September on the mat is sort of unwelcome at the Park Meridian, where there's this indoor plaza that is really privatized. And the article in the Municipal Art Society's comments sort of implied that what the owner was doing was unlawful, and they were restricting public access to this indoor bonus plaza. And that's what initially we thought. It turns out that when the Department of City Planning approves modifications to plazas and allows for a cafe, that oftentimes can be a full privatization of that public space. And so we've had somewhat of a learning process over the past few months, and we had an application about 2 months ago come before us. The applicant said, we want to put seating out, in portion of our plaza, but don't worry, the regulations require that it be open to the public. And in conversations with city planning, it was very clear that that's not actually the case. And there's no reason that the city can't require that cafe seating be open to the public, but the Department of City Planning sort of says, this is intended to be a privatization of public space. It's meant to, the cafe provisions are meant to activate space, which, that's their interpretation. The zoning text does not explicitly state that it has to be a privatization. And so we at Community Board 5 are thinking through sort of, what do we do about existing space that, let's say, has been privatized through these provisions, but also what can we do going forward? And so we had an applicant come before us seeking to sort of privatize some plaza space, and we worked very closely with Councilmember Gorodnik to make sure that did not happen here. And it was hard because the applicant and us came to an agreement, and we were willing to support seating for this outdoor cafe, but under the condition that there was signage that said that the seating was open to the public. And we had this agreement signed, from the applicant. and the Department of City Planning was not willing to let the applicant modify the approval documents for this, which was just, I mean, crazy. I mean, they can have signage like, no smoking, that's not, that is not necessarily required by city regulations. But it was odd, and we worked with Councilmember Gorodnik, and he threatened to sort of deny this application at the time that it came to the city council, which sort of made city planning reconsider and say, okay, well, maybe we'll let this cafe seating be open to the public, but they still said they would not codify that in the approval documents for the seating, and so we got a commitment we were able to get some written commitment from the applicant. They are planning to make this open to the public, but it's a concern for us of going forward of like, what is the proper procedure, and do we need to modify the zoning text to make sure that we don't lose in public space? And so I just wanted to flag that issue for you, and we at Community Board 5 are thinking through how best we can handle that. Another key issue is, we're seeing more and more construction accidents, and it's hard for us in Community Board 5 to think out what do we do about it? I mean, what leverage do we have to try to get better DOB enforcement? But just 24 hours ago there was an accident at this Steinway development site on 58th Street.
Oh,
yeah, like a worker unconscious after construction site fall. 116 West 58th Street. And it's one of those things where the DOB, no one wanted to really be the DOB commissioner because the job sucks. But it's hard, it's hard to think through what our we as a board and what everyone can do to get better enforcement.
The VP's office has a construction and safety task force that's been convening. And I know there's legislation being considered in the city council that Gail is supportive of, and I know she also attended the rally of the construction industry, bringing light to the attention that 17 construction workers have died in the last year.
If I can just may say so, this was a similar issue through the last construction boom before the bust, and a lot of these accidents also don't happen between 9 and 5. So off hours tend to be a huge issue as well.
All right, thank you. I want to make sure we got time to go through all the community board reports. Community Board 6?
Yeah, we have a homeless forum coming up in January. Our two council people, Rosie Mendez and Dan Gorodnik, are sort of spearheading it, we're co-sponsoring. It's January 5th. It'll be like a 3-hour session. There's going to be presentations, a question period, and they're actually going to have breakout groups where people can get direct input in a smaller scale and come back and then report, kind of in the way that you do a charrette. I mean, it's the same general concept. We're looking forward to that, and welcome anybody from any other district who wants to come. It's focusing on the street homeless in particular, and we have a couple other issues related to the homeless shelter that's located on First Avenue and 30th Street. We also expect the environmental impact statement on the sanitation garage that's being proposed for First Avenue and 25th. That should be by sometime in January, and that's going to invigorate our neighborhood. They're putting the sanitation garage right in the middle of our health complex, so a strip of hospitals and things along First Avenue, and nobody's happy with it, but we'll see what happens when we get the environmental impact statement. And the final thing is, I've been in as chair for 6 weeks, and already my district manager is retired. He's resigned.
He resigned?
He resigned.
What did you do to him?
6 weeks. I don't know what I did. We got two board members are gone. I mean, I just they're dropping like flies. But we do have to.
Oh my God!
So we do have to replace our district managers. So if anybody has anybody working in their offices who might otherwise be stymied by a long-term person in the district manager role, maybe bring it to our attention. We'll add them to the pool because we're trying to get as big a pool of as possible. So we have all the reach out to anybody who's got any And, yeah, otherwise, we're gonna poach them. We're just gonna come in there and say, we want your
Oh
job.
man, that's the reason why you lost everybody. You was aggressive.
Could be, could be.
When's the minors effective? When's he?
It's the first week of January.
Okay.
The exact date is not, he may not show up in January at all. That's where it stands right now, but I'm trying to get him to staff.
That's CB7?
Great. So congratulations, Christine,
do you mean,
on your 2 years of service. I was actually
Sure,
supposed to be in
my
that
name.
same position. Our community board actually voted to sort of revamp some of the bylaws a few years ago, and we actually I was given the opportunity to run for a third year, which I decided to do, and I am entering my third year now, so I get one more year. But I know we joined sort of roughly at the same time, and I thought we were going to be finishing at the same time too. So, and happy holidays to everyone. Just a few things, and I know I arrived a few minutes late, but I'm not sure if there was any discussion about the testimony yesterday and the city planning hearing. So I just would like to open that up. We did, and we had a good group of community board members who went bright and early. I was a little unfortunate about the room sort of being stacked with constituency groups in support of the plan, including the Hotel Trades Council and other unions who were there. It was also unfortunate that given the amount of work that I think all of our boards did, that many boards did not have the chance to testify at all. Last night at 11 o'clock, our land use co-chair
11 p.m.
11 p.m. She was there at 9 o'clock. She stayed until noon. Wow. She went back to the board office to chair the land use committee meeting, then went back at 11, and they gave them a slot. They said they would stay till midnight, but they wouldn't allow a second day of hearings. So I just wanted to flag that because I think it is something that the community boards, given our unanimous rejection of both plans, neighborhoods do matter, and I think it is something that we want to continue to try to push city planning on. So I would encourage all of you to submit the letters, anything that we can do.
There is a petition going on right now. Municipal Art Society and all of the organizations didn't get a chance to speak, and there are circulation of petitions saying this is unacceptable.
Right.
We were there.
There were 3 block long
I know,
line
we were there at 8 o'clock.
And I think it was
we were there at 8
particularly-
o'clock. I
yeah.
got in at 9, and then I got the number 150 multiplied by 4 minutes. I say, okay, I'm not going to testify until 9 o'clock.
Right, and I think the other, I think it's just particularly frustrating that the people who were there to stack the room were probably being paid to be there versus community boards that had done a lot of work and aren't getting paid, and most of us took more than a half day or full day off of work because we care about these issues. So it was troubling, but we'll see how things go with, my understanding is they will look at this and then the city council votes in February on the final proposal. So I guess the work continues, but we're going to continue to fight, given the amount of work we've done to reject both of those. Amsterdam Avenue, some news, if it wasn't reported last month, but we had a great town hall meeting discussing the Amsterdam Avenue prospective street improvements, which include a bike lane going northward from 72nd Street up to the end of our district. They are coming back in January. The DOT did do a great job in listening to us. We made a few comments and changes, and they're coming back for the final proposal in January, so it's been very swift. We wanted to acknowledge, I know sometimes the DOT doesn't work super quickly on things or as quickly as we want, and they really have done a good job, and we expect to vote on that in February, and there was near unanimous sort of support for their proposal. We are also working on a task force that is related to the Museum of Natural History expansion, which many of you have read about. I think the new design that was shown to us in the past month was to our liking, and I think that we feel the community, at least the community board, largely supports their revised design. Is only taking up sort of less than a quarter of an acre, less than 2% of the total parkland in Theodore Roosevelt Park. What people sometimes forget is that the museum space is actually situated within a public park. So most of the people who have expressed concern about the expansion is not because they don't agree with the goals of the expansion. It's going to be a great thing promoting stem cell education. STEM education. Sorry, not stem cell, STEM. And so the real issue has just been that loss of parkland and trees, and I think they've done their best to mitigate that, which we're pleased with. And then I guess 2 final things regarding NYCHA. We've sent a letter to the Borough President's Office, or in the process of doing that. We have 3 members of our board who are NYCHA residents, and they're very interested in trying to start a conversation with with Shola and with the borough president on some of the issues related to the, I guess it's the Next Gen initiative. And we're hoping that we might be able to get some time with the borough president or staff at some point in the coming weeks on that, especially as it pertains to the infill proposals. The final thing is there's a special meeting tonight. I think the mayor is at an Abney breakfast tonight talking about this in part related to sort of the homelessness crisis. In particular, he has worked or recently come out on the issue of veterans homelessness. And there is a proposal on the table to, in a current SRO, to build on somewhere in the 90s veterans transitional housing, and depending on who you ask, people like it or don't like it, but anyway, we're convening a meeting tonight in the neighborhood to discuss that. So happy holidays, and that's it for me.
Happy holidays. CBA, Jim?
We're thinking about changing the whole way that we vote. I've been trying to go around to various full board meetings to see how other boards do it, and we're thinking about going to either a ballot voting or electronic voting, because right now we go through an A to Z roll call vote, a very monotonous vote, even for votes that are unanimous. So we're going to try to be changing that.
Why don't you raise your hand?
Exactly. Also, from a sad but a practical standpoint, it seems as if the marine transfer station at Asphalt Green is going forward. Nothing seems to be able to stop it. There was a very strong, well-funded advocacy group whose mission statement was to not have it go forward. It now seems to be going forward, so this is a good time for Community Board 8 to step up to the plate, to fill the void, and to serve as the sounding board for the community, to monitor the construction as well as to mitigate any negative effects pardon me, that the construction will have. That's okay.
All right.
So we've started a marine transfer station task force that will start. Also, ferries are returning to the island. We seem to be an island without ferries. There's going to be a stop at 91st Street, as well as, oh, thank you, and 62nd Street. We're hoping that there'll be a stop at 34th Street, so that'll improve transportation. There was a big outturn for people opposing any of the city bike crosstown bikes on 72nd Street specifically. That was pretty much the major topic at last night's meeting. However, we have not made any decisions in terms of crosstown locations, and the Department of Transportation has not made any decisions either. And also, Matt has just alerted to me that there was news today as a discrepancy as to the starting date of the 2nd Avenue subway line. The MTA has always said December of 2016, but apparently, as reported in today's news, their consultant says otherwise. So we'll have to resolve that. Thank you.
Good morning, all. So a couple of things. One, yesterday on my way at work, not yesterday, last Friday, I got a call from Eric Landau, who is the Deputy Commissioner at DEP, letting us know that the formaldehyde emissions at the wastewater treatment plant at Riverbank State Park had exceeded their amounts. From what he had said, there are many different emissions levels across the country, across states. New York's DEC had put it at 30, and the latest emissions were put in at 32. What was a little bit troubling about that was they only started collecting data in September, and it's been open since 1987. So,
were they required to collect data before?
That hasn't really been fleshed out. They said that they were not. They only started collecting this information just recently because of some new changes that they were looking to make within the plant. They are in the process of putting in some new engines that might be putting out more emissions, although they're supposed to be addressing some of the stuff that's going out. So it just so happened that they were supposed to come and present at our board meeting that same day. So they did come and they let us know that they'll be increasing the amount of emission reporting for formaldehyde specifically. They are trying to determine under what conditions that encourage the increased formaldehyde emission. And we are also asking for them to consider other gases that they are not currently reporting on, to start looking at that, because there's a little bit of a back issue with the consulting agency that they're using to use for the air monitoring system. A couple of community residents have come and said that some of it is not calibrated correctly. So we have brought in Columbia University. They have been looking at some of the results for us and trying to determine whether or not it is calibrated properly and addressing issues. We've also asked them to take us on a tour, and that's going to be happening tomorrow, of the various air monitoring systems that they have in the area. So we're hoping to be able to pass that information on to the Borough President's office. Matthew, I know, was very interested. Thank you very much for the call that we received that same day in reference to what's going on. So we'll be keeping in contact. We've also touched base with City College so that they can get on board and we can utilize some of the experts at the college to determine where these emissions levels are. But it's
What's the risk to the resident?
Well, that's one of the things. They said that in order for it to have an adverse effect on a person, they have to be exposed to, I believe, for a significant amount of time at a much more elevated level. So technically, right now, exactly, and we do not know where those levels were before that. So it's very important that we try and get that.
Go ahead.
I gotta say, the wording on that press release scared the crap out of me. It was it was ominous. It was like, but then it was well, our standard is 30, the emissions are 33, but California is 50, so it's not, we still have better.
EPA is 800.
And then when people use an abundance of caution, they use that language, that always scares the crap out of me.
Does this fall in the red zone area on the map we just saw?
My heart sank when I took the call.
When you read it, you're like, it's one of those things that what's left unsaid. It was bizarre. You got to share that.
Oh, absolutely. So, I mean, that's the question: is what else is not being tested?
So what's important? Go ahead, Catherine.
So we hear what happens at your wastewater treatment plant, because what doesn't get treated comes down by CB1. So just to remind you, in the Hudson River. So there was a fire there for 4 years.
Yes, because then they stop.
It goes to you first.
I had a tour. We had a tour. I had a tour of some other people. So when you get your tour, you might want to ask what equipment they put in, and was it the same, just in and out replacement, or did they upgrade?
It was. There was no upgrade. So right now they're in the process of doing an upgrade, and that was another issue as well, because they came to us, they presented maybe a year ago, and they said, this is what we're going to do. We're trying to bring the upgrade, improve engines, to be able to take in more of the gas that's been expelled, so that we're going to decrease the dependency on external electricity, right? We don't want to use that much of Con Ed. We want to be able to use the gas and use it back into the plant. So and then...
Also, they are recycling the gas.
That's going to be intent, but what they also they told us a month ago was that the amount of emissions that was coming out from these generated engines was much more than they were expecting, and then now they're telling us they have to put a large shaft that in case it does get over, they are going to burn off this excess gas. And that was not initially told to us when they came.
So Matthew, and then we'll continue with the chair report.
It's an important issue. I mean, they talk about, in the DEP report, they mention that their levels are 30 micrograms, and that they were measuring 32 micrograms. There are studies that have shown that there has been toxicity identified in people with levels as low as 30 parts per million, which converts to about 36 micrograms, so it's very close to that level. And one of the things that also has a lot of impact is time period of development. So younger people and older people are certainly going to be impacted at a greater
Right.
degree. One of the things that I think is critical for this is they talked about monitoring throughout the park. The stacks are on the northern portion of the
Right.
park. If they go to the southern portion, it's probably about 10 blocks.
Exactly.
But what they need to do is they need to go east and they need to go north as well.
Right.
Because when I spoke with them, it sounded like they were just going to go across the street, maybe a
Right.
block in, but we
Yes.
need to push them to expand the
Extend,
monitoring
yes.
zone. Additionally, between September and October, you're not having as much rain. When there's more rain, you have more methane being used in the
Exactly.
process.
Exactly.
And so it becomes, the formaldehyde is a byproduct
Right.
of the methane use.
Exactly.
So there would probably be increased levels during
Exactly.
the spring and summer. So
Right, so-
it's something that we need
So
to stay on
sounds like
top
we're
of and we
working
have to
on a
continue
letter
to
or
work on it.
something?
We
Yeah.
may need to.
CB10? Oh, I'm sorry, were you done with the rest of the?
I mean, there are a couple more things real quick. We had a forum by Mount Sinai last night that was speaking to the district, so we got a pretty good idea. They are actually developing a district program similar to ACP, and we're trying to get some better information about how it's going to be integrated into the community. They're also selling off 4 of the buildings. Supposedly some of this money is supposed to come back into upgrading services at a few of the practices, the faculty practices. But again, there's one clinic that they own that is overused, and we're trying to get them to increase their presence within the community. We also got some press came out from Columbia Secondary School about a teacher inappropriate interaction between a teacher and a student. They actually were requested not earlier just for general information to come and present at the board tonight. So they'll be doing that, and they'll be speaking up a little bit more about that. So I know it's pretty quickly. Just 2 more things. We passed a resolution in support of the lane usage, lane change on Broadway between 135th and 153rd Street. So that's going to be happening. DOT is going to be putting that in process. And also, I think there are a couple of boards that are using iPads for the meetings. Is that true?
CD2 is.
We're trying to get anybody that have any information on that will really like that.
The lady to your right, CB11 is using them.
Great, so I want to
You're doing
speak
that.
to you. Okay, good. And that's it. Happy holidays to everyone. Thank you so much.
Henrietta,
Oh,
CB10?
thank you so much. I feel like a stepchild. We don't have a waste water plant.
You're landlocked.
We're landlocked, yes. So my report's a little bit.
No river, no river.
For Craig Cushing, I want to thank, it's such a pleasure with you on the board. I'm gonna really miss you. I really am. Just a few things. Tonight at our land use landmark meeting, we will have the first presentation with an organization that started in our community for Save Harlem Now is the name of the group, and it's going to be like a landmark preservation group, and I'm sure they're going to be reaching out to 9 and 11 in terms of looking at, this is the first time, looking at all of the buildings in our community that should be saved in statues. So we're going to start that. Valerie Bradley is the president of that. And we're looking forward to that. So I have invited them to our landmarks meeting tonight where they're going to present, and then I'm going to introduce them to the other boards to hear what they do and how we can work with them as boards. So that's one really great thing. Last night, our Public Safety Committee, basically, instead of having a meeting, they gave out, with the fire department, carbon monoxide alarms and fire alarms. It was very interesting. And of course, the BP's office offered batteries, but I think these ones are 10-year, and somehow they don't have some kind of battery that goes for 10 years. But anyway, that happened last night. One of the biggest things happening with the city bike is coming to Harlem, as you know. So we had our workshop, but of course, you know, DOT always comes with nice secrets. They had a complete overlay of where they think it should go, even though they didn't tell this to our transportation committee chair. We wish they did, so we can have a heads up. So they want to put and of course, we definitely, speaking for me, support the bikes coming in, but we want to be very careful of all the parking spaces that may be eliminated as a result of that. But I walked around Central Park over the weekend, and I saw all the bikes on the sidewalk and different places. I'm going to roam around New York to see just how the bikes are integrated into the community. But right now, they want to do 15 bike stations, somewhere 36 to 46 bikes apiece in a 20-block area. So I don't know how this is gonna go. It seems to me like a lot of bikes, but, the fact that bikes are being used in the community throughout New York City. I wish DOT would do a comprehensive study of all of Manhattan, because right now they're chopping things up, and yet a bike lane's here and it goes up the map, and then it's 5 blocks away. So I wish they would really do a comprehensive plan for Manhattan as a whole, so, we can really get this going. I think having all these bikes are fabulous, and seeing other people use them over the weekend was amazing. So that's one of the big things.
Henrietta, did they
yes.
allow you all to say that they would reconsider some spaces if you let them know if they were businesses or other concerns?
Yes, and we're sending them a letter, and I have the support of all of our elected officials. Again, the biggest concern is eliminating parking spaces, because so much is happening, with the 125th Street SBS bus, 200 and something parking spaces basically disappeared, and DOT is still trying to tell us where 100 and some odd parking spaces are, but we haven't got that information yet. But, so, given that block, and, I talk to people all the time, and people are waiting outside their doors 2 and 3 hours for parking. This is, oh my God, this is insane, but this is New York. So we just don't want the bikes coming in to impact those individuals who do have cars. Atla Church. This is the church on 120, I think, 3rd and Malcolm X Boulevard. And they continue to put up these derogatory signs. And the more, and the borough president said this, the more you basically confront this minister or his congregation, the signs get worse. And I'm not sure why Landmark or whoever the agency is can't go and just remove the sign, because the sign is illegal. It was not there when they landmarked. It was not supposed to. It came up after. But I know that's a big contention in terms of what's happening. You reported to landmark? It's been reported.
The borough president's office has been working with landmark to try and push them to pay more attention to the sign. And in fact, we actually alerted them to additional violations that kept occurring. They seem to prefer to go the route of doing environmental control board violations and hearings, which has already happened back in August. We'll circle around back with them and see if they can be a little bit more aggressive.
Okay, that would be
but that's where it stands right now.
Okay, we're trying to be very quiet. I know you've been working with our LGBTQ community too, but it's in our community. Everyone said, why aren't you doing anything about it? What can we say? Everyone's
put city bike in the place.
I want to ask them the question, why can't you just, the sign is illegal, why can't you just go there, remove it?
Well, that's what I said too.
They wouldn't give me a straight answer.
Yeah, they have about 6 or 7 violations, and 2 signs are illegal. They're actually right. And Christine just came up with an idea. We'll put city bike there.
City bike right in front of it.
We'll put a city bike in.
Then you'll have a negotiation.
Is that your update?
That's my update.
Thank you so much. CB11?
Okay, I'll keep it short. Good morning, everyone. And first, I want to thank the Manhattan Borough President's Office, as well as Jesus, our community liaisons, and of course the Deputy Borough President, Matthew Washington, for getting the lock on the 102nd Street Park, as you may or may not know. It's been really advocated by our district leader, Teresa Richardson. They have a lock on that park. What is so important is that the recent shooting of the police officer, the alleged shooter, ran through that park because it was unlocked. So we want to thank you both for making that happen. And of course, we're asking you, of course, to keep watch, because as we all know, sometimes they lock it, sometimes they don't. But it is critical because it is a hangout for some of the local gangs. Second on my list is that our East Harlem neighborhood planning is continuing, and we're coming almost to the end in January, and we're continuing to make sure that the public hears what the recommendations are. So in January, all of the recommendations are coming to our committees, and we are moving the venue, which normally we have at our board office, to a larger location because we anticipate more public attendance. So we will send, of course, to you guys a list if you plan to come, would like to hear what's going on as well. Third, some interesting things are going on in our community. Before I move on to that though, we did have City Bikes come to us. We did do the work group, even though the day that they chose to do this work group was in the summertime. So we know what the attendance was like in the summertime. So we pushed back. They gave a presentation at our last December meeting. We had a lot of people there. I understand, I was not there, but I understand they almost came with pictures, you know, the torches and the pitchforks ready to say about parking. Same issues, don't put it in front of my building, that type of stuff. What we have realized is that they are open to hearing suggestions and feedback. We are going to be doing a walking tour of the map. And to see exactly where they're putting it and see if we can get community agreement as to where they are.
If I may, in our case, early on, we did a walking tour, we told them where to put it, and then we ended up in different places.
Well, they've already mapped, as she said, they mapped where they want it. We're gonna say, okay, map.
Not this one.
Yeah, that type of thing.
Can I just suggest
This is
one
really,
thing too?
really important because, I mean, we were early on, so this was a little bit of an exploration, but it was frustrating that to say, put it here, put it there, and then one day it shows up in another place. You say, what are you doing?
Right.
So I know both of your community boards were also interested in tourism, and the tourists love City Bike downtown. So you might want to think of like destinations where that might benefit from something like that.
Thank you for that. That's a lead-in for my next point. Tourism. East Harlem, for the first time in its 3 major corridors, has holiday lighting. Holiday lighting all the corridors. And it's a major accomplishment for us, aside from it hasn't been done in a very, very long time. But it was all local grassroots fundraising. So you walk 125th Street, thanks be to the neighborhood, which is the NEMA organization, the local East Harlem Merchant Association, on 106th Street. If you may or may not, you need to come and see our beautiful tree on 106th Street, which now is accompanied by a huge snowflake in the middle of the intersection of 106th Street.
And you need to do the lighting of the tree instead of lighting the sun.
Well, yeah, and that was our point, because it's for the children. It's festive for the children, but it also encourages local shopping, which is why we're so proud of it. And 116, thanks to our speaker, we have poinsettias and street lighting all throughout from Park Avenue. So I just wanted to mention that because that adds to, of course, festivities for the community, but also attracts tourists because they want to see it. Just some other items, and this is real quick, just a point of information. We talked about Pathmark last time. Across the street from Pathmark, if you may or may not know our intersection, there is a huge commercial building. It has Dwayne Reed, Raymond Flanagan. The building was recently sold for $75 million to an organization that we're not too familiar with in East Harlem, Thor Equities. So it's interesting what's happening in East Harlem. And then the Riverton, you may or may not be familiar with this, it's 135th Street. They just recently were bought by a new company called A&E Real Estate, another new company that we are not familiar with. A&E Real Estate. But in addition, they got $100 million tax breaks from the city to maintain the Riverton as affordable housing. Which is something. The new company? We're not sure yet. Stay tuned. I'll be able to tell you.
Thank you. CB12. Good morning, everyone. Happy holidays to you all. At our last executive meeting, our local senator, Senator Espaillat, was before the board. As you may have read in the newspaper, he's proposing a moratorium for Inwood on new OPL on-premise liquor licenses in a particular zone north of 10th Avenue, if I'm saying that correctly, where there would be no more new applications, basically wouldn't impact renewals or beer and wine, etc. However, the senator has put together a proposed package of legislation that was presented to Community Board 12's Executive Committee calling for a home rule. While we know that a moratorium cannot be called based on the current ABC laws, he's working to present legislation that would alter ABC laws to allow a home rule where all of the local government, including the community boards, in one accord, it would basically be empowered to say, well, this particular area is just oversaturated or there's just too much going on here with liquor licenses, OPLs. and that would empower them to call a moratorium temporarily in order to get that area up to par, once again allowing enforcement or whatever regulations that need to be set forth therein. So the executive committee did support it with some amendments, where in the current law it indicates that the SLA would be the last word. We included that no, it can't be that way, that if we set the moratorium, then we're the last word. Was that, and then we also added within there as an amendment would be that once we identify a geographical area that has been oversaturated, that once that zone comes out of the moratorium, that there would only be recommendations for 2 a.m. OPLs. We have seen throughout that these establishments do not need to be open to 4 a.m. to make money. We have seen that research shows that the later people are out drinking, the more trouble happens. People are assaulted, hurt, hospitalized. There's all types of things, and you know what happens. If you look at New Jersey, they close at 2 a.m. The streets are clean, people are home. And there's not as much activities and issues going on. So I'm not sure why we need the great city of New York to be open so late and probably past those hours, people drinking
To make money for
too much.
speakers.
We get that, but when you think about overall health for society, that is just a little too much. So that's what's happening there. Yeah, I can send a copy of the resolution, and it appears, I think East Harlem is talking about some things like that, from my understanding.
Guys, I know everybody's
So I
getting a
will
little anxious, let's just stay
send,
focused for the next 2 minutes.
The resolution, and we do have a copy of the legislation.
Yes.
I'll circle it.
So you're gonna circle a copy of the
Secondly,
legislation.
our LGBTQ task force, which was recently formed, is still in motion. Our chairperson, Richard Allman, is actively interviewing a bunch of individuals who are very much interested in serving, and I should be meeting with them shortly. Well, for me as well, it's a bittersweet moment, folks. It's been 3 years since I've been serving as chairman of Community Board 12 proudly. December 31st will be my last general meeting is the term, the 22nd is my last part of the board. So truly indeed has been an honor to serve with all of you, to be at this, as I call it, the table of the knights of community boards. I just want to leave you with one thing. You know, we get a lot of riff, you know, a lot of pushback, but we truly indeed are the voice of our communities. Keep up the fight. Don't be influenced by no one. Do what is best for your community. And if that means you get removed, so be it. But it's about our communities. And what we do, as you mentioned, is all pure volunteer work from the heart. And we have to keep that real. And we have to keep that in motion. So truly indeed, it's been a pleasure and it's an honor to be here. I may pop up occasionally because I want to know all the good stuff that happens here. But it's been a pleasure serving with you all. So thank you.
Thank you. Community board,
That's it.
Community board 13.
13.
Report out from the borough president's office.
Sure. A couple of things. First, again, congratulations and thank you to Christine and to George. Certainly a pleasure working in the Manhattan Borough President's office with you, and my personal experience as a fellow chair. So we thank you for your work, and excited about the work that you'll continue to do for your communities. A couple of quick things, and then Jessica and I want to give an update on MIH and ZQA. So first, I wanted to mention that on Friday evening or afternoon evening, the Manhattan Borough President's Office held its youth council gathering. There must have been 80 young people in this space. It was an incredible event, and my favorite part of the evening, I wasn't here for that, but the coolest part was the lights went out, and without skip of a beat, every young person turned on their flashlight on their cell phone.
And amazing is to wear
and continued the meeting. And you know, I think it is that innovative thought process. It wasn't televised.
You should see the Twitter feed.
So
We should put more up on Twitter. We'll try to get more.
You know, I can't underscore enough the importance of getting young people to the table,
Yes.
allowing their ideas to go. Because if it was us in that room, we would have been running around looking for power. So continue to support that. One thing I did want to mention, we are looking for a new budget director at the Manhattan Borough President's Office. So if you know anyone who is familiar with the city's budgeting process, please let us know. We'd be happy to talk with candidates. And then 2 grant programs that are extremely important that we've released. Well, not grant, but the police community initiative that we've launched, really trying to engage communities with police, and we are giving out $12,000 awards. So please encourage organizations that you know who are doing this work with community police engagement to apply. We want to make sure we get it to really deserving organizations, and it's just a phenomenal opportunity to do some great programming. And the deadline is coming up pretty quickly. January 8th is the deadline, so please get them in because it has to be used within this fiscal year.
And it's not that onerous, the application.
It's not.
I have a quick question. Is through that program, do you get access? Do you also help the organization have more access to the police to work with them?
So we're certainly happy to help facilitate.
Right.
I mean, it doesn't necessarily outline in the process that we're going to give access.
An option.
But it's
because I think it would be very valuable.
Right, I mean, I think we're looking for organizations that have an interest in developing those relationships, and somewhat they have to have a plan so sort of on their own of how to do it. We're of course always happy to bring people in and to provide access, of course.
Certainly.
Yeah.
And the other thing, everyone should receive an email about this today, but the Manhattan Cultural Tourism Grant Program is being launched. And this is in partnership with the New York City and Company Foundation, but we do give out small grants that focus on tourism and culture and communities, looking at museums and other things. So in places like Community Board 11, where Diane has talked about the importance of tourism, certainly great opportunities to do that, and so we're giving out small grants for that.
Make one plug. So a couple of weeks ago, one of our volunteers, Kathy Schreier, sent out a survey to all of the community boards about workforce development. And so wanted to get information from the boards about workforce development programs happening within your community boards. And also maybe eligible organization or people that would be interested in participating. We're going to resend out the survey because we did not get any response. Okay, so we sent it out to all the chairs, the DMs, and also to specific committee chairs. But we will resend it because we all get a lot of email, and so we will extend the response deadline until the end of January to get responses back. Okay.
Great, excellent. So as we heard a little bit earlier today, yesterday was the City Planning Commission's hearing on mandatory inclusionary housing and zoning for quality and affordability. Elizabeth talked about some of the concerns in terms of being able to get in and actually present testimony, which we've heard. Christine talked about emails that are going around, so it's something that we're certainly looking into. We certainly want to thank the Borough Board and all the community boards for all the work that they did to address this in a very condensed time frame, 2 large text amendments, but you all certainly did incredible work and really helped inform the Borough President's work and her ultimate recommendation, which was circulated on Friday with a conditional no on zoning for quality and affordability, but with a yes with conditions on mandatory inclusionary housing. And she presented testimony yesterday. If it did not go out to you all yesterday, it will.
It's going out today.
Yeah, okay.
Yes.
We'll get testimony.
We'll make sure that
Is it on YouTube or you have that on YouTube?
It's actually on our website currently.
Recorded?
No, not.
It's not recorded.
Yes.
Just her testimony. Text. Jessica, did you want to?
Yeah, I mean, I think we've had so many conversations about this, and so I don't want to prolong the meeting for a long time. We can certainly talk individually to anyone, but I mean, basically, this was a really tough process for everyone in this room, and it was for us as well. It was a lot of back and forth and city planning saying, well, we could fix this and that, and it was a very arduous process. And I think, I hope that everyone feels that, we did an okay job in coming out in a good place. The reason for the yes with the mandatory, and, I think it's more clear to this room why we were no on ZQA. I mean, there were so many neighborhood issues, and that have to be dealt with that the administration just hasn't dealt with yet, and we're hoping that will happen moving forward. But for the mandatory inclusion area, I mean, I think that the borough president really does feel like people who build in Manhattan right now need to include affordable housing, and this is a way to start to make that happen. In addition to the work that's being done, the amazing work in East Harlem, and that's really getting off the ground in Inwood, and that, you know, hopefully will be a process for inclusionary housing, you know, the idea that now special permits will be included so that people who are increasing residential units in their, you know, will have to have some affordable housing in their projects was a really big deal for us. So that was one reason that we felt that we could be in favor of this. The second, you know, and these are the big ticket items, just so you know, and one was that we've been talking for the past 2 years about the fact that the voluntary inclusionary housing program, which covers 20% of Manhattan, needs to be fixed, that there's big flaws in it, we're not getting enough affordable housing, and they did agree to fix it, and so that was a sort of, we felt like a big win. And then the third piece is the fund for that you know, that will be used to build affordable housing in those situations where developers aren't putting it on site. We did feel like that there were some big wins around the transparency of that fund, about regular reporting requirements that HPD will do. And biggest for us, and this was huge for Gail, and those, you know, you who all know her and know how big this is, that the money needs to stay in the community. So we got, you know, they started with a very little commitment, oh, to stay there for a couple of years, and then, no, so we got 10 years, and even in 10 years, it has to be a consultation, you know, what's going on, if there are possibilities coming down the pike, and then after 10 years, it will never leave the borough, and that was really important, it will never leave the borough. So with those big things, there are still some big ticket items to be discussed, but we're very much hoping that with all of us in this room talking to the city council and all of our friends in the city council, that the other things will be addressed, such as the AMI bans, the percentage of off-site housing.
Workforce option.
Workforce, right, exactly. So those are still some big ticket items. We did get a commitment that they were gonna work on them, though. It wasn't like the doors closed and it voted up and down.
What about the voluntary, they got 30% on the voluntary?
I'm sorry?
They agreed to put 30% on the voluntary
They-
inclusionary or not?
They didn't make a commitment to the change to the voluntary. The
But they
commitment
said
was
they
that they will change it. So
And soon?
that's gonna be
Right.
ongoing
With
work.
the date?
Yes, they actually
As a part
said,
of-
they
yes.
said, I don't remember what they
I can't
said,
remember
but
what
they did give a date.
It'll be
when
part
they
of
would
this
start.
timeline.
Yes.
Yeah.
Just a quick question, does the borough president's testimony trump, or like, how is that seen by the city planning commission versus the board's votes? Is it
Well,
seen
it's
as separate?
bigger.
It is bigger, but is it separate, or is it seen as a sort of a reflection of what the community boards?
I think I think what city planning knows that they need to do or to make some changes, and I think they're gonna be ongoing. I don't think, you know, ultimately the city council has to vote on this, and
Right.
that's, so the question is, what will the city planning commission do before the city council votes?
Sure.
And I think, given the outcry, and given how much work everyone's done, and given the, you know, how often do borough boards get reported on in the newspaper? I mean, everyone was talking about what the borough boards are. So I think they're gonna take these suggestions and make some real changes. Whether they'll be enough, we don't know, but
Right,
that's
right.
sort of gonna
But
be
it
our
Yeah.
job
And I
moving
think
forward.
to
In
that
terms
point.
of the reporting and the tally, I think, as Jessica mentioned, I mean, the borough board itself will still be reported on as voting it down,
Okay.
just like the other
Okay.
five boroughs.
And I just,
Right,
I
and
also
then
just wanna.
just additionally to that, Elizabeth, I know that the city council is looking at every community
Okay.
board's
Right.
resolution.
So they're not gonna just say like.
No,
okay.
they have every community board's
Okay.
resolution around the city. So I think
Great.
it's important that each of you in your
Go to-
roles
We should be
speak
lobbying,
with
like,
your
yeah.
council members,
Council
talk with them,
okay.
talk to the people you know,
Okay.
continue to talk about the issues that need to be addressed in
Right.
this.
And I just want to give a big thank you to your office who sent one of your planners to our land use meeting last night, and there were a lot of people there who had questions about Gail's decision, and I think they felt really good after.
Oh, good.
that. So
That's
thank
great.
you.
Yeah.
Henrietta?
Okay, this is really good, and thank you so much. One of the things I'm a little concerned about, I know we talked in the last meeting around this, that city planning will be reaching out to all of the boards to look at their individual concerns. Will that happen, or is this just gonna be thrown in the pot? I mean,
Is it happening
before the
Is it
vote?
happening
That's what
before?
you're saying.
Well, you know, that's something we're continuing to work on. I mean, the fact that
Yes.
everyone said no to ZQA, and the reasons were because you had to listen to each individual
Right.
board. So our recommendations are really strong about that, and I think, you know, that you have to look at the considerations of every single community board. So that is gonna be our ongoing work. You know, it'd be easy to say, you sure they're gonna do that? I can't guarantee that, but that's certainly what we're gonna continue to push them to do. And I don't think they're gonna be able to get anywhere with the city council unless they've addressed every board. I don't
Right.
think they'll ever get to a yes if
Absolutely.
they don't do that.
I don't think we're, I mean, yeah.
Just a question in regards to the MIH, because it came up during the Borough Board about the radius from where they're going to build on site, that 1.5 miles out. Was that, I didn't get a chance to read the testimony, but did Gail bring that up, that they need to reconfigure that because borough are connected, and if I go 1.5 miles out, I end up in a different borough?
No,
It stays in the borough. It's mandatory to stay in the borough. So in terms of the fund, it is what we were able to get the commitment on is 10 years within the community district. At the end of, or close to the end of that period, there must be consultation with the community board about sort of where they are, plus, as Jessica mentioned, annual reporting on where that fund is. If it gets to that 10-year period, you don't have projects within the community district, it must stay in the borough, but what we've said is they need to focus on projects that are close to the community district, so within half mile, because we want where funds are generated, we want them to stay there. So it is guaranteed staying within the borough.
Just one more thing maybe for the future discussions. I'm really concerned with the bike share program. While it's great for tourism, for people to get around, density-wise in the city, I mean, I envision New York City coming a place where we're going to be walking shoulder to shoulder one day. We can't move. We have a lot of vehicles, and it's cool to expand bikes, but I think when you think about these plans that are coming forth, especially for projects that don't require parking, and then you talk about going into neighborhoods that are already overly populated with vehicles and individuals, that's going to be a concern. Maybe we should start talking about recommendations to create parking facilities for these bikes in hubs as opposed to taking up sidewalk in the street. Why don't you create a location, a bike station where people go into on the first and second floor, bring down bikes like a parking lot.
That's a whole nother.
I'm just throwing that out there.
At a point where I think everybody's looking for.
We should really think about where are we going to walk if not the bikes are on the side.
I'm sorry, I just want to do one other item because I think it is relevant to everyone. There was this court decision, this was CB7, Elizabeth just left. There was a developer putting a proposal to build next to a school. Parents started a lawsuit. The judge just ruled yesterday against the development, and based on a faulty environmental review, and the environmental review didn't take into account the realities of a school. And I just think it's going to affect absolutely every community district because it's going to make it much harder to build next to schools, and which we think is a good thing probably. And so you have to not only look at noise and air quality, but also the amount of time that the construction takes, which might seem short to a resident, but it's an entire school year basically. It's 260 something days in this case, and that's usually what construction projects are. So I just wanted to raise that because if those issues come up in your community district, we should talk about it. This court decision is really interesting. It just came down 2 days ago.
So Mo, you want to?
It was PS 163.
We're just there.
Just a quick reminder that community board applications are available. Please take them. Please distribute them. At least half of your board members' terms are coming up.
And we also have a year review. So take a bunch of copies of what you've managed to accomplish at the Borough Board over 7 votes, over 18 presentations. So a motion to adjourn? All right, no objections. George Gray made a great point. Christine Bertin, you may want to take
Take these home with you if you want to.
And we'll see you at your last.
You guys have a great day.